Good morning and welcome to our interview series with our 2021 Hope Rising awardees. Today I'm joined by Amy Sharpe. Welcome, Amy.
Thank you.
And I'd like to give a little introduction on you before we begin with the interview today. Amy Sharpe co-created the Health Subcommittee for the San Diego Region Human Trafficking and the San Diego Regional Human Trafficking and Commercial Sex Exploitation of Children, known as CSEC, Advisory Council. The subcommittee is a multidisciplinary group including physicians, nurses, mental health professionals, social workers, and executives. Amy has networked with local healthcare systems, as well as professional associations and clinical students sharing evidence-based practices to establishing policies and education to identify and support victims of human trafficking. Amy built a sustainable network that can easily transition to future leadership. She has featured vulnerable populations, including Indigenous peoples, foster youth, the intellectually disabled, LGBTQ+ youth, and boys. She confronts stereotypes of victims and exploiters and advocates for laws that support victims and clinicians. She shares resources to support resilience and address vicarious trauma. She recorded 468 volunteer hours in the past year, reflecting her desire to make a difference in our community. With a solutions-oriented approach, she has earned the respect of local and national experts. Thanks so much for joining us today, Amy.
Sure. Thank you.
I'm wondering if I'd like to start off knowing a little bit about your background in anti-trafficking work. What made you get involved in this type of work?
Well, I have a friend who is with the FBI who investigated locally for several years. And so I was aware of the problem. She also worked with our youth at church. And so that intersection was really impactful. So I was aware of the problem, but I didn't really get involved until a friend invited me to his church for a seminar on it. And it was the first time anyone had ever said, and you can get involved in making a difference. Because before that, it was very, yeah, that's horrible. Let's clutch our pearls. But there was nothing that I'd been presented with that I could do something meaningful. So at that point, I started attending community meetings and learning more and saw where there were needs and started to pitch in.
Awesome. Thank you for sharing. I'm wondering, what are some of the challenges that you face in your day-to-day work?
Okay. It's a topic that people care about, but our recent challenge is healthcare is very focused on the COVID-19 pandemic. And what's interesting about that is the disparities in who is impacted by that are very similar to who is impacted by human trafficking. So competing priorities are often a problem. Getting people to focus on, instead of the problem, focus on the solutions. I find that when we keep our energy focused on solutions, the work is more meaningful for everyone, and the outcomes are definitely better for everyone. One of the obstacles is, the people want continuing ed with that. And so I'm really grateful for Sharpe volunteering to do a continuing ed series for us. There's some really credible continuing ed that's well sourced and free that the Office of Trafficking in Persons has done for health professionals. So we didn't want to reinvent the wheel, but we are doing instead trauma-informed care, which is a really vitally important gap in education for human trafficking, but also just in general with healthcare providers. If they can add that skill set to their clinical practice in whatever setting they work, it'll elevate the standard of care that they provide for patients.
Completely. I'm wondering, do you find that there are maybe some misconceptions that people hold about human trafficking?
Yes, there are a lot of misconceptions. One is that what we see on TV and movies is what it looks like. And while that's not untrue, it's also a very narrow part of what human trafficking looks like. So, and especially here in San Diego, the dynamics are, we have middle and high school kids being trafficked, and sometimes by their peers. So if we understand local dynamics, it's much easier for us to respond appropriately. A lot of the idea of kidnapping is really prevalent in what people understand human trafficking to be. And again, while that's true, kidnapping does happen. That's not the norm. And in fact, a lot of the coercion is the norm. And that person might be in their home and maybe even doing normal everyday stuff, but also being trafficked. So when we understand the subtle differences between what we have seen portrayed and what is really happening, and focus instead of on stereotypes, on control dynamics, then we see, that our LGBT youth that are estranged from their support systems are being trafficked more often. And we see that boys are also being trafficked. And we see that although this happens too frequently to kids without an adequate support system, like foster kids and homeless youth, it also happens to kids that come from good homes. So when we understand those things, then we can respond appropriately and not overlook people.
Yeah, completely. Keeping that humanity at the center and focusing on this solutions-oriented kind of mindset. That seems very important and encouraging. Thank you for sharing that. I'm wondering, in your work, what are some of these gaps that you're seeing in services? I know you're talking about certain marginalized groups here. Could you speak to maybe some gaps in services?
Sure. One concern that has always and likely will always be an issue is that when we interrupt those exploitation and we offer support to someone, there's never adequate housing. So, and not all recovery processes require a residential facility, but they do. Especially with young people, they need to be placed in a safe environment where they can begin that healing process. And there's just not enough of that. And that will likely be an ongoing issue.
Yeah, completely. Yeah, I'm wondering, people want to get involved. I know after hearing your stories and the way that you've been involved and some of our other awardees, I know that this will be kind of an inspirational kind of tone for some folks who maybe would see a little passion ignite in their hearts for anti-trafficking work. If someone were to approach you and said that they wanted to get involved here, could you speak to maybe ways that folks who are interested could educate themselves, and then also thinking about maybe tangible expressions of help as well? What do you think would be helpful?
Sure. And of course I'm healthcare centered, but the sort of health and wellness education modules that are for healthcare people are also just survivor informed. They're always with best practice, and they're free, so anybody can take advantage of that. And they're a good foundation for what is the right approach. I think it's important to know things like not to refer to survivors as victims, to have a very hopeful outlook, because then the work you're doing is very sustainable. If we get too much in the weeds, then we have a tendency to fixate on trauma porn or share trauma porn, which is not really helpful. And I say that because it just, like, porn rewires your brain to fixate on things that are not healthy and natural. And so when we instead have a survivor focus that is geared towards solutions, that really listens to the survivors and does things in an empowering and trauma-informed way, then the outcomes that we have when we're teaching, when we're sitting with people and teaching best practice, those that attitude conveys itself. So even just in imagery, it's really important to use imagery that doesn't degrade or reinforce stereotypes. You know, I am doing a training at one of our local hospitals here next month, and they sent me a draft of the flyer, and I sent them an image that I was like, you know, maybe we could use this instead, because it doesn't imply gender, it doesn't imply captivity, it doesn't imply ethnicity. So when we don't imply a stereotype, then it helps people to have an abstract idea and really see everyone.
Yeah, completely. And you bring a very unique lens to this picture as a healthcare provider. I'm wondering, could you speak a little bit to your co-creation of the health subcommittee on the San Diego region human trafficking?
Okay. Well, we first of all don't have a budget, so the tools that we use have to be either free or easily sustained. So we started with a Google group with I think it was less than 20 people that we began with. And that of course is free, which is convenient. And then we have the historical record of what has happened since the beginning. If I were to go back and look at it now, I'm sure I would be amused at the things that we started with, because I didn't know nearly as much as I do now. We, with COVID-19, we switched to meeting online, and whenever it's appropriate, we've been recording those meetings, not all of them, but most of them. And so I've been uploading those to a YouTube channel so that people can go back and view that to either refresh themselves or to catch what they've missed. And so using free tools whenever possible is great. I also have a friend that's a local scientist that he sponsors our Zoom account, and another friend that sponsors our thank you notes that are electronic that get signed. And when we invite people to speak, we try to focus on solutions, or for example, when we had a panel of survivors speak, we have a document that not only for building protocols for a healthcare system, but for all engaging with survivors, this is what's appropriate and this is what's not appropriate. And so the questions that were presented were constructive and solutions focused, instead of survivors just saying, this is my trauma history. And so everyone who attended that meeting, including the survivors, had a positive experience and learned a lot. And that's when we keep a solutions focused approach, it makes a difference in how that information is conveyed and absorbed.
Completely. How do you take care of yourself while you're navigating this kind of work? It's so tolling and very draining and very heavy. How are you able to practice self-care, or maybe what kind of practices do you do to help take care of yourself and keep you recharged and refreshed and ready to continue this fight?
Oh, that's a great question. I think I struggle with self-care like most of us that are involved. I recently had a full body massage that was well overdue, especially with the pandemic. One of the things that I do is I'm a foster youth mentor. So I spend time with my nephews. When they got adopted, they adopted me as their aunt. So we go out for mandatory fun, and that's been harder with the pandemic, as we've had to be a little bit more separated. And I look forward to those visits because they take me out of the heavy realities that I deal with on a day-to-day basis, and they're just more carefree, and you know, I get to put on my kid hat and just have fun. So
Yeah.
and get lots of hugs and and time with the kids.
That's fantastic. And also recharge you for more work and more change that's to come. I'm curious, what sort of long-term goals do you hold for the groups that you're affiliated with, or for yourself? What kind of vision do you have for our region and our world that is free of trafficking?
Well, I think as healthcare, I mean, trauma-informed care has been around for more than 30 years, but it hasn't been adopted universally. And I think the more that clinicians adopt that into their practice, the more they can diffuse tense situations, the more that they can help a patient feel like they're in a safe space and they can trust that person, and they can work through those things, whether it's a high score because of a troubled childhood or a current situation. They're going to have better health outcomes. And that applies to human trafficking, of course, but just a whole spectrum of the things that contribute to the vulnerabilities of human trafficking. People who have been abused as children are more likely to be trafficked, or who've come from a past of poverty or a broken home. So adopting those things in a healthcare setting would be a major accomplishment if healthcare could do that, because not only because it'll impact human trafficking, but all of the related things and health outcomes will improve. So as a healthcare subcommittee, we tend to put everything under the trauma-informed lens. And I'm grateful that Sharpe is going to help us to magnify that with some continuing ed. For myself, I don't know. I'm always trying to get to the next project. You know, I think what would look like success for me is if I empower future leaders so that I'm replaceable. You know, not that I'm looking to step away from the work anytime soon, but if we have leaders that are equipped with best practice and that are engaging in the community, then that's what success looks like. And I think, you know, the more I do that with colleagues and equip them with that knowledge, I'm planting that seed too. And who are you going to be mentoring as you get your feet with this? Because to keep the work sustainable, we need to be growing future leaders. And that's part of the reason why we really welcome students of nursing students or medical students. We want them to integrate the knowledge into their practice.
Awesome, thank you. Yeah, passing the baton on to the next generation is so important. And thank you for creating dedicated spaces, continuing ed programs, and online groups, even with just using free tools that are available. I think it's really inspirational for folks to know that you can really make a difference. So thank you so much, Amy. The theme for our event this year is Hope Rising. So I'm curious, if we're thinking about hope, we're thinking about a brighter future, a world that is free of human trafficking. And I have one question for you. What gives you hope?
Gives me hope. When I see my nephews who have struggled with trauma that's not their fault, take responsibility for it and make better choices. When I see people make what people would probably term a sacrifice, but taking their own personal time and investing that in learning best practice and learning things that will help their healthcare system to adopt best practice and be able to teach others best practice and continue to move this forward. That gives me hope, because I know then that those things will be self-sustaining.
Completely. Awesome. Thank you so much for sharing, Amy. Thank you for your work in the region and in the world. I know you're a very inspirational person for folks who want to get involved in human trafficking or anti-trafficking efforts. And thank you so much for your time today.
Thank you.
congratulations on the Hope Rising Award. Also, we're so pleased to recognize you for this work in building a brighter world. So thank you.
Thanks, Connor.
Awesome.